Health Novo presents Sushruta, our health awareness channel.
How do I prevent gum diseases? And there's a usual question, there are so many toothbrushes in the market, which one should I use? And why? Let me explain to you how to prevent gum disease. The gum diseases, as I explained, it is due to plaque accumulation that converted into tartar, and then you get inflammation of gingiva, that is gums, and you get gingivitis. So the first thing is to remove the plaque day in and day out. Means you brush in the morning, you brush in the evening. Now there are different types of brushes available in the market. Now let me divide into two sections. One is hard, medium, soft, super soft, sensitive. One is hand brushing and motorized brushing. That is the second category. Let me tell you, hard brush is the worst thing. Government should not allow them to manufacture only. Medium and soft, but I will recommend soft brush, because unless or until you know how to brush, even medium brush, you can cause damage to your teeth and gingiva. The soft brush is the best brush for most of the people to start with. Then comes super sensitive, super soft brush. That is for those people who constantly get gingivitis or gum inflammation again and again. They should use that super soft brush because their gingiva or gums are sensitive. Or those people who have already gone through the treatment of maybe advanced gum diseases, for those people that super soft brush is very important. But the most important thing is your dentist will advise you according to your condition of your gums what brush to use. Now in the market they show you crisscross, straight, this, that, etc. They come out with different types of brushes after studying different alignment of the teeth. For example, I would like to show you this picture here. Now, if you look at this model, if the normal tooth alignment is there, you can use normal brush. But sometimes the teeth are in and out, sometimes teeth are bulky, whatever, or sometimes you have got some replacement of teeth done, then the brush differs. What I suggest to you and what I usually advise to my patients is get couple of brushes. Most of the brushes which are manufactured with evidence base. Don't just go to the market and buy any brushes. Ask your dentist, because we recommend those brushes where the study has done, clinical study has done, after using the brush, how much teeth are cleaned and which area is cleaned properly. So get couple of brushes at different angles. Use one in the morning, second one in the night, third one next morning, or 1 week one brush, 1 week other brush initially. Why do I say that? Because if you hold the brush like this, and if you are brushing, see my brushing hand, this is moving, this is moving. Now the movements of your wrist and movements of a hand is different in different human beings. So there is not one technique that you have to do this way. What you have developed from childhood, the habit, you do brush that way. So when you are brushing in a different way, one brush will suit you, and that brush will tell you that, okay, if you use me, the plaque will go away properly. And once you are confirmed, once you are convinced that your plaque is removed with that particular brush, which is soft, but the bristles are in different angles, use that brush. I won't say this company brush or that company brush. Use different types of brush which suits your mouth and you feel fresh. There is no plaque accumulation. And to see whether plaque is not there or not, use disclosing solution which gives that redness where the plaque is. So that's about the brush. But those who have already developed a habit of brushing very heavily, very strongly, they should go in for a motorized brush. This is a motorized brush. It rotates completely, or some brushes go 180, that's the rotation they do. So this brush, you don't use any force, you just lightly put on the tooth surface. Lightly put on the tooth surface. The movements of the brush will remove the plaque. So each brush, you can see this is for the gum area, this is for the tooth area, this junction of the gum, this is for the tooth, that will take care of it. But if you have any disease, you have treated for advanced gum diseases, then there is, gap between the teeth, then not only brushing the teeth, but you need something called interdental brush. This is an interdental brush that goes between the teeth and that removes the plaque between the teeth. This is a little thicker. A thin version is also available. This is a thin version which can go in between the teeth in the gum area and clean that particular area. So this is about different types of brushes and which one you should use. Then comes floss. Floss cleans the teeth at the junction, in between the teeth. That's the area where most of the time plaque accumulation takes place, tartar takes place, because your brush bristle doesn't go there. So this is a floss. So you have to remove the floss about 12 to 18 inches. And this floss, usually I see somebody rolls in the middle, first finger, etc. No. You have to roll in the middle finger, like this. And this index finger and the thumb will direct the floss in all the teeth, including your last near wisdom teeth. So flossing, if you floss properly like this, there won't be a damage to your gums and bleeding, and you will clean the plaque. Now, how to brush? How do you hold a brush? I've seen people holding the brush very tight. See the wrist here. And when they hold the brush tight, the movements come from the elbow. And when the movements come from the elbow, you are not brushing the teeth, not removing the plaque, you are rubbing the brush against the teeth and remove the enamel or damage the gums. Plaque is very soft. So you should hold the brush, and the pressure on the brush should be like a painting brush, very lightly. And when you hold the brush lightly, the movements come from the wrist. So where is a plaque, if there is a plaque here, and if you move the brush very lightly and fast, that will remove the plaque. Removing the plaque is dusting, not scratching. So do it very lightly. And the most important area is the inside area. Inside this area, near below the tongue, where there is a salivary gland and the tartar formation takes place there. So this is the area you should brush. And use disclosing solution, so you'll get to know where the plaque accumulation is. There is one more thing which is available, what we call as a water floss. And that water floss is this. You press, you get a water jet coming, and that water jet can remove the plaque in between the teeth. There are other things available in the market, and those things are what we say is water pick, where there you can put in the tank water with mouthwash, and that mouthwash with the water jet, you won't get gingivitis or gum diseases. These are specifically for those people who have replaced their teeth, those people who have gone through advanced treatment for advanced periodontal disease. For them, this type of advanced gadgets are necessary to maintain their oral hygiene. As I told you, the brush has to move up and down, never move horizontally. Why? Because the tartar which is there in between the teeth will never come out while brushing horizontally. I would like to give one more example here. This is a comb. These are the teeth of the comb. If there's a dirt in between the teeth, you can't remove it horizontally. You have to remove it vertically. But for that, you need a pin, straight pin. You don't require a curved pin. With a curved pin, you can remove this. Same way, your brush bristles has to be straight. If it becomes like a flower, you are brushing psychologically. You are not brushing to remove the plaque. So brush bristles has to be straight. So when do you change the brush? You change the brush if the bristles turn round, and they turn round if you are brushing very heavily. Otherwise, you should change the brush approximately after 3 months. And you will make out a difference. The bristles become very soft in 2-3 months. And by a new brush, you feel that the brush is now cleaning properly. So changing your brush, even if the bristles are straight, is about 3 months. But if the bristles become like a flower, you have to change that brush immediately. Not only change the brush, but change the brushing technique. And lastly, just want to show you a kit which has got everything in this. We got an electronic brush, we got tips for that, you got a floss, and you got a tips for interdental cleaning. For those people who have got that self-treated for advanced periodontal disease, or those people who have got implants or any prosthesis, any replacement of teeth, they should get one of these kits so that they can clean their teeth properly. So if you use this way, I don't think you will get dental problems or gum diseases. And last and the most important thing, a car always go for servicing. Why? Because you don't want that car to stop on a midway highway somewhere. Similarly, your mouth requires servicing, and the servicing is necessary. So you should visit a dentist every 6 months, because the tartar formation convert into gingivitis or periodontitis takes months together or year together. So if you visit every 6 months, just for maintenance, just for servicing of the mouth, I assure you, your teeth will remain in your mouth till you are in this world.